we should start by talking about how we might implement all those points that you've just mentioned. But I'll hand over to Sophie Scott now to take us through the discussion. Thank you, Sophie.
Thank you. Thanks, Tony. And I'm glad to say that I'm actually in the Northern Sydney Local Health District. So I'm very glad to hear that we're the only health district that has that planetary health report. So let's hope we're not the only one or the first of many. But that's good to know that there is some movement. So let's move on to the panel discussion. Don't forget, we want your questions in the audience too. So please pop them in the Q&A and we'll try to get to them at the end of this session. We've heard in this, if everyone can turn their cameras on, everyone in the panel would be amazing. Thank you. You know, we've heard in the speakers really clearly outline that we have a major problem. What we want to talk about now is some of the potential solutions, and we've heard about how serious the problem really is. So we want to sort of become solutions focused in this session. And I want to start by asking some of the panelists, what are the practical steps that we can take so that healthcare systems can adapt to the challenges presented by a changing climate? And I'll just go around a couple of the panelists. Lucy, I'll start with you.
So what can the health sector do, did you say, to become?
Yes, what are the practical steps? And I'll ask most of the panelists, what are the practical steps that we can take so that healthcare systems can adapt to the challenges that are faced by a changing climate?
So I guess, yeah, I mean, there's the adaptation and then there's the mitigation. So, I mean, in terms of adaptation, obviously health systems need to be prepared for surges of demand and need. And I think we certainly need clear adaptation plans, and they should be incorporated into existing emergency response plans. I think a lot of health services are not prepared. We need early warning systems. We need data collection systems. We need to be able to let hospitals and services know when there's going to be an increased surge. But then, of course, there's also the mitigation. So in terms of health services that are looking at their actual own emissions, but I think others are going to be speaking about that, and that's probably another question. But I do think we need to have much more comprehensive adaptation plans so that all health services are actually prepared to respond now, not in sort of 5 or 10 years' time.
And Peter Doherty, from your view, the practical steps that you would like to see taken? I think you might be on mute, Peter. Everyone on the panel can unmute themselves, Hisham and Tony and everybody else. You can unmute yourself, that's no problem.
I mean, the practical solutions, really, they're not really related to the infection issue that I spoke briefly about. I think they're the same issues that have been coming through all this. I mean, firstly, it's clear we have to take adaptive steps. As Leslie Hughes said, you know, there's no way this is going to stop overnight. It's going ahead. There's at least 20 years built into increase already there, and there's no particular sign that we're going to be able to move our politicians and so forth. And anyway, it's a global problem. We're just part of it. We're not playing a particularly great part at the moment, and we could play a much better part, but it is a global problem. So I think sustainability of construction and thinking through every aspect of the healthcare system, as people like Tony and so forth are doing, to see where the steps are that can be taken to increase resilience so we don't have excess mortality or an excess load on the healthcare system. I think awareness too. I'm very much involved in public communication around COVID, and that makes you recognize the limits of how you reach a certain segment of the Australian population. And you can see that happening with what's been happening in Melbourne or with the rollout of vaccination frequencies. We have 90% plus vaccination, which extraordinarily good result. And I think the states that are below that, as soon as they get a bit of a fright from COVID, they'll shoot up as well. So we've got a population of people that are willing to listen, willing to act. They're also putting solar systems on their houses. A lot more of them are riding bikes and so forth. That's another whole area where we can sort of be improving things with making that safer and more friendly. So I think it's those steps we could take that really actually don't threaten our economic system and in fact actually build economic opportunity, building houses more sustainably. I mean, we just have to put the real estate developers back in their box and say, yes, maybe we don't need to live in a mega mansion, but we might live in a smaller house, which costs as much to build, but is much more climate sustainable. I think there's a lot of regressive and crazy stuff going on, building in climate endangered areas and so forth that continues. So I think one of the things we really might think about is how we improve our whole communication system. I think we're going to need the help of 20-year-olds and younger people who are much more active in modern communication than most of us are. You know, I've been on Twitter, which is really exposes you to some extent the extent of human goodness and the extent of human insanity. Because there are a lot of people out there who are completely mad, and also there's, you know, the climate change deniers and COVID deniers. They're exactly the same. They're not necessarily the same people, but they're exactly the same phenotype. They have set positions. You knock one down, it's whack-a-mole. Up comes the next one. And often it's a completely predictable sequence. So I think we might think a lot more about communications much more broadly. It's not through getting articles in newspapers or even writing an article for the conversation. No, that's a really good thing for any academic to do, because that does get a very...
You need to get on TikTok if you want to get the young people.
That too. So we need young people doing this in our institutions who are in contact with the message we are trying to get out. And we all have communications departments, and we have some very good people running them. But a lot of that communication is at the 20% top level, actually. And so I think we should be thinking much, much more about trying to really get messages out in telling ways.
Interesting. Tony, your last slide, you had a lot of great suggestions there. If you had to prioritise those, or what do you think are the key practical steps that need to be taken so that the healthcare systems can adapt, or we can really increase the focus on this issue in society?
Yeah, thanks very much. I really support the points that have been made by others. And I guess for me, one of the things I think Chris Tobin was referring to this as we were assembling earlier, when he said that he'd always been concerned about waste from healthcare, but had never felt he could talk about it because, healthcare was such an important thing. And I think from an ethical point of view, in a sense, there's a bit of a moral offset problem in a way with healthcare, where because as healthcare professionals, we're primarily concerned about our patients, the people we're caring for, we tend to think that the environmental issues are somebody else's problem. And what needs to change, we're in this Anthropocene together, we're changing Earth's systems hugely now, the climate system, biodiversity loss. It needs to be everybody's business. Inside healthcare, we're not protecting the health of people if we're polluting the environment at the same time. So we've seen this revealed with the pandemic, with all of the personal protective equipment. We've all seen masks on the ground around the place. When we think about all those plastic gowns, I know we'll hear from Forbes McGain in the next segment. These are big obvious issues, and we have to take them seriously as health workers. And I guess that comes to my first point in that list of 6. We need to authorize health workers to make this part of their job.
And Leslie, that's something that you've said as well, isn't it? That you really feel that that health and science experts have an important role to play because of the high regard that they're held in to take an initiative on this issue. That's correct, isn't it?
Look, yes, absolutely. I mean, people that work in the health industry are trusted voices in our community, and it goes to Peter's point about the importance of communicating with all sectors of society. So actually empowering our doctors, our nurses, and all other people involved in the health industry, and getting them better educated about the impacts of climate change on health, and putting them into positions where they feel confident to communicate with their patients or their colleagues. That's really key. But you also ask the others what the most important thing to do actually is, and I think there's two. One's about mitigation, one's about adaptation. So the mitigation part is that we absolutely need governments at all levels who take this seriously. And we do have state governments that are now taking it seriously, but we don't have a federal government that takes it seriously. So I always say the number one thing that we can all do is vote for climate action at any election. But the second thing is to being prepared. So, a few years ago, there was a Productivity Commission review on how we deal with natural disasters, which of course are becoming more and more unnatural all the time. And they noted that 95% of resources were spent mopping up afterwards, and only 5% were for preparing beforehand. Now, given that we know at a broad level what's going to happen in terms of so-called natural disasters in the next few decades, we absolutely need to be better prepared for it, and that includes our health systems. So not just turning around and mopping up after bushfires or floods or heat waves afterwards, but actually anticipating them more intelligently.
And Nairi, you spoke about the Indigenous wisdom and how we should be learning from Indigenous wisdom and Indigenous science. What could that look like in a practical sense? What would you like to see happen in a practical sense to address some of these issues from an Indigenous wisdom point of view?
Well, luckily for us, there are plenty of exemplars already in terms of how we've been able to take some of that really age-old wisdom practice and translate that not only into, some of the research that for the so-called validation of what we already know works, for example, but and I noticed that in the chat there were several links to some really saucy pieces of work, particularly, say, by the Lowitja Institute. We know that there are multiple initiatives around the country whereby we are training and growing Indigenous rangers and other workers to protect environment, but also to promote positive Indigenous practices around environmental management, about land rehabilitation, bush tucker initiatives, for example, such that we're commercialising some aspects of that to reset the public's understanding and their relationship with some of our Indigenous knowledge, and then using that to, as a foray into far more kind of impactful aspects of what we have to offer. And I've always said that we have to offer, and we will continue to offer, because our communities are probably, like a lot of communities around the world, those with the least often offer the most and are most generous. And I know that that is true of Aboriginal and Torres Strait Islander communities. And we are able to operate not just in that kind of ancient wisdom, sort of, naked in the desert context, but we are trained as Western scientists, as doctors, as teachers, and, as, chemists and lab jockeys, and all of those fabulous places whereby just our very presence, existence, and our willingness to share that information, like ripples on a pond, will impact individuals and then services and then systems. We've infiltrated politics and policy spaces in public health, in clinical practice. And as we continue to do so, then, much like a lot of other traditional knowledge, people are very cool about, say, Chinese medicine, for example. That may sound a bit kind of trite or twee, but it's just now part of what, people now see as part of a more comprehensive and holistic health environment. I've normalised it, right? So we can normalise Indigenous practices in the same way. So we're not a sideshow. In fact, it has often been said, and particularly, in our environments, that as the oldest continuous culture, it will be our mob, our people and other Indigenous communities, if the rest of the world are smart enough and are humble enough to ask, that can lead us out of this. That'll...
Thank you, Nari. Now, Hisham, I just wanted to go to you and ask you, how important is it for companies and industry to play a role in environmental health and to step in when maybe, particularly some governments aren't stepping up?
Yeah. Well, thank you very much, Sophie. And before I answer that, if you indulge me just to make a few comments on the last question, because it's also something I'm quite passionate about. And I tend to look at it on two levels: the micro level, at a health service level, a hospital or a facility, what can be done to optimize the operations. But at a health system level, I think many participants will recognize there's a lot of waste and inefficiency in the system. We have a very disconnected system, and therefore the journey of patients through the system can often lead to unnecessary interventions, tests, procedures. And so to be able to take out some of that volume and achieve what we would sort of say is the right care to the right patient at the right time is the kind of ideal that we should aspire to through better integration and a better interconnectedness, particularly between the primary care sector, doctors, GPs, the community, and also the acute care sector. In terms of the role of... Sorry, you're breaking.
We're going to talk about that more in the next session as well. That's a big focus of our next session, is making sure is the low value care point. And I'll just get you to answer the over what Boop has done. And you were mentioning the targets Boop has set, but also that it's going to be more difficult for you in Australia to meet those targets, given the position Australia's in. I might just get you to share that with the audience.
Yeah, sure. So the first point to make is that historically, when I started out in business, we kept focused on business outcomes and we stayed away from social issues. And I think no longer is that a possibility. Like, major corporations play an important role in the communities in which they operate. Our people expect us to take positions on socially important issues. Our customers expect us to take positions. And whilst some of those may be polarizing and not everybody's going to agree with us, I think we've come to accept that that is now part and parcel of contemporary governance in large organizations. And so for us, we felt compelled to address the challenge of climate change in a way that was relevant to Bupa's activities in the health and care sector, both locally and globally. And because at a local level, we still have a high dependency on coal-fired power stations, it's inevitable that in order for Bupa to meet its 40% aspiration by 2025, or indeed our net zero by 2040, then the impact on our local operations here is going to be more significant. And I think we're up for that. We understand that at a country level, we need to work harder and faster to accelerate our transition from fossil fuels. And it's something we're very prepared and up for. And we've got a number of initiatives that are in progress, including new power purchasing agreements that are able to leverage renewable energy sources that are currently being tendered for in the market, and we're going through the best of providers. So we're actually feeling that we're up to the task and that we're going to deliver against very transparent targets as well. We've currently got the UK's Carbon Trust auditing our baseline assessments, which we've used in 2019, to make sure that we've got that baseline assessment, and then they'll come back and they will validate the aspirations, because I think we need to be held accountable, and we're holding ourselves accountable for delivering that.
Good on you. Now, Claire, I might just go to you to talk about data, and the data you presented was very striking, but I might just get you to share with the audience what impact would it make if there was better data, so it was easy for us to track the impacts of a changing climate on health, and maybe just tell the audience some of the difficulties that you had in pulling that data together that you showed us, that it wasn't easy to find, you know, the sort of uniform data across all the different jurisdictions of Australia.
Yeah, thanks, Sophie. So yeah, we, you know, health data at the sort of nationally is collected with quite a lag. We put out our hospital statistics, you know, a year or so after that things actually happen. So if we had sort of quicker systems and we're able to track things, you know, more regularly, that would help inform people what's going on. I mean, today I've just read there's a thunderstorm asthma warning in Victoria. And, you know, if there's more kind of up-to-date data that can track that, that would be helpful. For our report with the air quality data, for example, different states have had different levels of when they considered something hazardous or, you know, low levels. So trying to pull that all together and make it consistent nationally so people could understand it was tricky. And the environmental data is collected at a really fine level. You can get that data at very low geographic levels, whereas for health data, because of privacy concerns and confidentiality, which is incredibly important, you can't always do that, and you have to, you know, look at it at a higher level. So putting it together with the environmental data, it's hard to make those associations for different types of data. So yeah, just a little bit of work to be done there, and it just requires interdisciplinary teams, really, and I think that's key.
But if you have this, and this is something we're going to talk about later as well, if you had the issue of sustainability embedded into hospitals and embedded and tracked, it would obviously make your job a lot easier if that data was more readily available, wouldn't it?
Absolutely. Yeah. If we could collect it at the same time as we collect the data about how many patients get admitted to hospital for what reasons, if you could collect it and put it together, it would definitely make it a lot easier and could, for example, help look at associations to feed into, Lucy presented on the burden of disease study, so we could look at things more broadly at a national level.
I wanted to briefly touch on one thing we haven't mentioned is mental health. And I just wanted to go to Tony and ask, what are the flow-on impacts to mental health from a changing climate? We mentioned a couple when we spoke.
Yeah, when we are thinking about climate change, we tend to focus on the physical health impacts, and indeed that's true in healthcare more generally, that mental health is often overlooked. But if we think about the recent prolonged drought in Australia, what we saw from the climate point of view, obviously drying of the soil, and then declines in agricultural productivity in various regions around the country. And this leads to declines in the incomes of farmers and declines in their economic activity in the broader rural communities. And so our psychiatrist colleagues, Ian Hickey, for example, and others, are concerned about depression among farmers and in farming communities and suicide rates. And this is not just an issue here in Australia, in India, elsewhere around the world. So that's just one example of where we're seeing mental health consequences of climate change. And another aspect of mental health in this context is concerns about eco-anxiety, particularly for young people. When our elected officials in our parliaments are not taking climate change seriously, it's understandable that young people, teenagers, school children who have learnt about climate change at school, unlike many of our elected officials, because climate change wasn't necessarily in the school curriculum, so they needed to learn about it in their continuing education as parliamentarians, and perhaps some of them don't engage with new information as they perhaps should. So understandably, that's enormously distressing for young people when our elected officials are not taking this seriously. So that's another area of mental health consequence.
So look, we've only got a couple more minutes left before we need to have a break, to give the audience a break before our next session. But I just quickly wanted to go around to a couple of other panelists just to get last thoughts, because I know that you all made amazing presentations. Lucy, did you have any last thoughts? You mentioned some initiatives that would make a difference, like, you know, looking at walkability of where we lived, which can have those double benefits of both the health and the environment. But are there any other initiatives that, from a practical sense, solutions we should be focusing on as well?
I guess from my perspective, I think really what's important are strategic alliances between the health sector and other sectors, because not only sort of public health more broadly, but certainly climate mitigation has to happen across sectors. And as I think has been mentioned, you know, the health sector is a very influential and powerful voice. And there are actually many common goals that we have with some of the other sectors. So I think those strategic alliances are really important, and we need to make sure that the evidence that we collect addresses all of the different outcomes, so that we can make evidence-based arguments together rather than kind of having conflicting messages. So yeah, I think, and I guess that's one of the reasons why I think the groups such as the Climate and Health and Alliance are so valuable, because their framework's been endorsed by over 60 health organisations, and I think, you know, coordination and information empowerment is really important.
And Peter, I'll just go to you for a last quick comment, and then Nairi. Oh, Peter, I think you might be on mute, Peter.
I'm a bit out of it. Yeah, massive challenge. We have to change hearts and minds. And I think we also have to change a number of politicians and reward them with a long and happy retirement to private life.
Okay, thank you. And Nairi, just for last comment from you.
Sure, honey, repeat the question for me, darling, because you know my answers are never succinct.
Just your last thought that you'd like the audience to take away from your key message on this issue of how do we embed environmental issues to make healthcare sustainable, but particularly calling on the Indigenous, making sure we embed the Indigenous perspective as well.
That is a huge question in a very short period, but I think that one of the components in terms of how we can do it better is that place-based and localised response to priorities, engaging your local agencies, understanding what we have to offer in each area. It would be very different in far northern Queensland than it is to here, to Victoria or Western Australia, for example. But that richness and the extent of our content expertise is actually quite extraordinary. So what does that look like? And the potential for that to then influence some of those local responses in the prevention space, in the crisis space, and then in the healing and reparative space, I think is quite extraordinary. That's the kind of simple answer.
All right. Look, thank you. Look, we've just run out of time. We've got to give the audience a bit of a break before our next session. But look, thank you, everybody. Thank you, Leslie, Hisham, Peter, Claire, Lucy, Tony and Nairi. You've been amazing. And your presentations, they'll be on the PCHSS YouTube channel for the audience. I'm sure you'll want to go back and watch them because they were all absolutely fantastic. We really appreciate it. Thank you so much. So we're going to take a short break. We're going to be back at 3:30 for our next session. So thank you very much to the panel, and we'll see you